in 2016, myself and two other activists locally started Rise and Repeal Waterford, because there was an absence of other groups other than People Before Profit and so on, who've always been pro-choice, but any grassroots groups just didn't exist. And our goal at the time was to get some information out there. We didn't, in the early days, tackle the issue very head on, I suppose. We weren't, and it testifies how we grew over time, that at the very start, abortion itself was a difficult topic to discuss amongst ourselves, even though we were all pro-choice. Over time in Waterford, we've seen other groups develop. TMFR Waterford, a branch of TFMR for fetal abnormality, Parents for Choice Waterford, which is a very instrumental group in terms of highlighting crisis pregnancies in a family situation, as well as Pro-Choice Waterford. And we also grew in the southeast to encompass the Southeast Coalition, to highlight more regional rural need for access to reproductive rights. We included groups like Carlow for Choice. We have 8 here as well today, Kilkenny, Wexford. We even had groups from Wicklow, and we would have had some training groups here in this building for the Southeast Coalition. So there was a massive swell in the last year of the campaign, and I think it was those conversations that were had, the solidarity that stemmed from people having conversations and sharing their stories, removed a lot of the silence, a lot of the shame around the topic. So that was huge, and it really went to change minds. We saw people who had previously been anti-choice in the 80s and 90s come out and actively in support of achieving abortion rights, which was phenomenal, given that in the early days Vic, Una, Aid supported us in this, but in the early days we weren't even sure whether we would use the word abortion. That was an actual conversation we had. Crazy to think about it now, but that change was huge, and it's the non-hierarchical approach that was taken in the campaign nationally that really enabled people who wouldn't have been active in any campaigns previously to get involved. It was a very open movement, and gave a platform to people who just simply wouldn't have had it before. So now, Una mentioned there that on the 7th, any constitutional impediment to abortion rights in Ireland has been removed. Obviously, the legal battles that had to be faced in the interim were frustrating, and they won't be the last of any stalling tactics that we experience are over, but there's a number of issues to address in the legislation that we hope to be introduced soon and in effect in January, which is not soon enough. But 66% of voters voted for yes, and they voted for free, safe, legal on a myriad of different circumstances, and that's what we need to ensure is introduced in the legislation. And we're marching on the 29th of September, so next week the 7th annual march is happening, so I definitely encourage everybody to get along to that if they can. After the summer recess, the report stage of the bill is going to be considered by the Dáil, and then that will be passed to the Seanad. So between now and then, I definitely recommend that everybody contacts their TDs. Fine Gael TDs are going to have an open vote, so it's important that everybody is influenced in that sense, in a similar capacity that we try to implement the vote. Excuse me, my cold is getting in the way. But I'd encourage, letter writing, emails, calls, to ensure that we cover a number of bases, because at the moment there are still 10 to 12 pregnant people travelling or accessing abortion pills online. So I'm going to talk about some of the factors that we need to consider in the legislation. Marginalised groups, of course, we're looking at migrant women, women in direct provision, we're looking at trans community, Merge are a great group to look at for that, and I suppose it's our responsibility as members of groups that are maybe not marginalised to ensure that their voices are supported and their voices are put to the fore. There's some great information on Merge, actually you can look them up online, but marginalised groups are disproportionately affected by abortion restrictions. Fetal abnormality, we want to ensure that nobody's left behind, and between now and January we want to see the government funding any families or pregnant people with fetal abnormality and their cost to travel. Rogue crisis pregnancy counselling agencies, we'd demand that the government immediately address that issue and remove the current misinformation that has been given to pregnant people. People who are being deliberately misled on abortion information and what options are available to them is a must. The affordability barrier is huge. So if abortions are only available through private healthcare clinics or at a restrictive cost, working class women, migrant women will be unable to access them. So it's prohibitive for people who don't have access to their own finances. We're talking about people in abusive relationships, again people in direct provision, and removing the cost barriers allows people to access abortion earlier, which is obviously safer, and abortion rights should be provided in a government funded public healthcare service, as mentioned previously as well. Exclusion zones, so around the time of the vote we saw the UK prohibited campaigners outside abortion clinics, and we'd like to see the inclusion of exclusion zones in the legislation. You know, you see it in the States, you see it in the UK, and they are consistent, active anti-choice campaigners that will show up every day between abuse and intimidation of people who are in crises. So that is something that is an absolute must. Conscientious objection. Some of you might have seen Breed Smith debate Cora Sherlock recently on that topic. And you know, you look at Italy, where this is a huge issue, and conscientious objection is a tricky one. Do you oppose it on moral grounds, or do you oppose it because you have a list as long as your arm of women coming to you to access abortion because they can't access it in their hometown or their area? And you see in Italy a critical decrease in the amount of medical practitioners offering abortion services. So that's a personally I would like to see no conscientious objection. And if we do, then a referral is a must, but it's something that we really have to watch, because that's a really it's a really easy area for anti-choice institutions in this country to target, and they already are. So this is a really critical part of it. And then we have Northern Ireland. So we saw Simon Harris obviously indicated that he's committed to facilitating pregnant people in Northern Ireland accessing abortion services here. But travelling to Dublin might be cheaper than travelling to Liverpool, but there are still those financial barriers, and pregnant people in Northern Ireland face criminal sanctions. So this is something, decriminalising abortion access in Northern Ireland is an absolute must as well. So that kind of brings me on to Roe versus Wade. There's a brilliant documentary on it at the moment on Netflix if anybody gets to see it. But basically there's been 300 restrictions introduced on abortion in the States since 2010, and you see the strategic targeting of the appointments of judges, influencing politicians in the States to bring these small changes. But 300 changes is a huge impact. You see presidents like Reagan, like Bush, trying to achieve the pro-life, the anti-choice vote, particularly in areas like Texas. And obviously Trump. Sorry, my throat is getting me. Apologies. But it just goes to show that the fight isn't over. Roe versus Wade, abortion was legal since 1973, and the fight is still going on. So it means that we need to remain organised. We need to remain vigilant. We need to ensure that there are still spaces where activists can join, even now, if they weren't even involved in the campaign. And that's something I'd really like to see happening. And that, I suppose, our goal as various groups that were members of Waterford Together for Yes would like to achieve as well. Separate church and state is obviously a huge factor in that. Remove religion from our schools, remove that indoctrination from our schools, allow open conversation with kids about what their reproductive rights are in factual terms, rather than I suppose what all of us here would have grown up with in Irish schools, where it's just not a topic of conversation at all. And you might be lucky to learn about what impacts you and your reproductive rights maybe when you're a little bit older, 20 years older or more. And like was mentioned previously, we're not single issue people, and during the Repeal campaign there was a lot of groups that have different political perspectives and different moral perspectives came together on this issue, and continue to do so now on issues like the housing crisis, homelessness, still waiting. We have the cervical cancer scandal as well, and this is what we need to do. It's been proven to work, bringing people together on a targeted issue, and PBP have been instrumental in this, really, particularly locally and nationally, so for that to continue as well. So some lessons learned from previous campaigns. You look at the 80s, you look at the 90s, you look at the Yes Equality campaign, and what happened after the immediate I suppose the sense of urgency was off, groups disbanded. And we see it ourselves locally, after a difficult campaign people need some time off, but it's important to ensure that we remain organised, because without organised groups, you see it with the Occupy movement in the last decade, without a political ideology or structure it goes to nothing, and PPP are definitely an effect for change in that sense as well. So
thanks Ashley, thanks very much.